Welcome back to the Supreme Skin Podcast, broadcasting from the clinical sanctuary of Beverly Wilshire Aesthetics at 9100 Wilshire Boulevard. On behalf of our founder, dual board-certified specialist, Dr. Banush Zarrini, we continue our uncompromising pursuit of truth in an industry currently obsessed with shortcuts. If you are new to the Maison, you have entered a space where assembly line beauty is rejected and cellular longevity is mathematically engineered. Today, we are lifting the heavy curtain on a clinical failure that affects thousands of patients every single day. A failure that corporate medical spas routinely dismiss, hide, or completely deny. Let's address the exhausted look you never asked for. Let's talk about the heavy brow. You scheduled an appointment to soften your forehead lines. You expected a refreshed, open, rested gaze. But instead, within 10 days of your treatment, your face feels like lead. Your upper eyelids look hooded, your eyebrows have dropped in a straight, angry line, and you look completely exhausted. When you call the high-volume clinic down the street to complain, they give you the standard scripted response. Oh, it's just a settling phase. Give it 2 weeks. Or worse, your muscles are just relaxed. It will wear off in a few months. Let's be entirely clear. A frozen forehead that forces your eyelids into a heavy droop is not a settling phase. It is a fundamental clinical error. The anatomy of the upper face is a delicate game of structural tug-of-war. You have elevator muscles that pull things up and depressor muscles that pull things down. Your frontalis muscle, the wide muscle spanning your forehead, is the only elevator muscle in the upper third of your face. It is the sole mechanism responsible for holding your brows up. When a generic, template-trained injector blindly injects units across your forehead to erase every single wrinkle, they completely paralyze your only upward support system. Without the frontalis pushing up, gravity takes over. The brow collapses, pushing excess skin down onto your upper eyelids. They didn't fix your face, they trapped your expression behind a lead curtain. True luxury aesthetics requires an understanding of necessary muscle compensatory tone. If an injector doesn't mathematically calculate your safety margins or evaluate the hidden weakness of your levator palpebrae superioris, the muscle that actually lifts your eyelid, before they inject, they shouldn't be holding the needle. At Beverly Wilshire Aesthetics, Dr. Zarrini treats facial anatomy as living architecture, not a flat canvas.
We reject the outdated practice of freezing the forehead. True rejuvenation requires preserving the micro movements that keep your gaze bright and naturally open. Through precise structural mapping, we target the precise depth of the frontalis, while simultaneously treating the depressor muscles around the brow. This creates an intentional upward lift, softening forehead lines while actually opening up the periorbital frame. This is clinical certainty. We don't drop your expression, we elevate it. I am Dr. Banush Zarrini. Until next time, keep your standards uncompromised.
Your gaze is the window to your vitality. It is far too sacred for an assembly line shortcut. Stop settling for a heavy cover-up. To experience the true standard of supreme skin, visit us at bwaesthetics.com or step into our flagship clinic in Beverly Hills, California. Let's restore the architecture of your face together.